Hi guys, welcome back to my channel. So today I wanted to talk a little bit about my Graves' disease diagnosis, and then I would like to give kind of an outline of what we tentatively have planned coming up in the next few months. So I'm going to backtrack a little bit. About 10 years ago, 10, I was diagnosed with Hashimoto's thyroiditis. On my mom's side of the family, her mom had thyroid disease, and I believe that they took half of her thyroid out, and that was, I don't know what year that was, but quite a while ago, like before they really knew too much about the thyroid and Graves' disease and Hashimoto's. So I kind of wonder if there's a genetic link. I don't know. I have so many autoimmune problems, it's hard telling. But anyway, so the Hashimoto's started 10 years ago. And so Hashimoto's like makes your thyroid enlarge or become diseased, and you get, like, it can wrap around your esophagus and your esophagus and your trachea and like your vocal cords as the goiter gets bigger and bigger. My mom tells me that my grandmother did have a goiter, which really stuck out. My goiter is more like it's growing back, like towards my spine. But doctors, every time they touch my throat, they're like, whoa, your thyroid's really enlarged. So anyway, over the last 10 years, there really isn't much that you can do for Hashimoto's except for kind of watch it. I had to have an ultrasound done every single year because with Hashimoto's, you're more likely to get thyroid cancer. So, being diagnosed for Hashimoto's, the doctor who diagnosed me, he felt my thyroid and he's like, yeah, that's enlarged. So they did an antibody test. I believe it's a TPO antibody. And that came back like sky high. But anyway, so that's been going on for the last 10 years. And I wouldn't say that it has bothered me all that much, other than the fact that, for several of the last couple years, I've been complaining about it's difficult to swallow. Like, things get stuck right here in my throat. And here recently, I've been actually like losing my voice a lot. So anyway, back to Graves' disease. So back in May of 2019, we had been checking all my thyroid labs once a month, like consistently for years. And I noticed in my May lab work that my thyroid levels were off. My TSH was super low. I think like 0.05, I believe. And then my T3 and my T4 were high. And so I had addressed this with my primary doctor at the time, and they didn't seem concerned about it. They're like, well, we'll check them next month. And they actually thought that I was hypo. I'm not sure why they thought that, other than maybe a lot of people don't understand thyroid disease. But anyway, so that happened in May. In June into July, I was hospitalized with like a really, really high heart rate, and I had dropped like 30 pounds in a month, 30 to 40 pounds, and maybe it was a month and a half, 2 months. But so anyway, that's disappointing that I was in the hospital. They knew that I had thyroid disease, and they never checked my thyroid levels while I was in there. So anyway, I got out of the hospital like the first week of July, and then in August, second week, I was back in the ER because I was having severe chest pain and like these, it was just the most sickening feeling, and it hurt. Like it felt like my heart was just squeezing. And when I talked to the ER doctor, he said that I was having PACs, pre-atrial contractions. And that stinking hurt. It's not cool. That was a hard couple weeks. But anyway, we increased my heart medication, and they put me on a different kind of medication to like settle that down. So, but anyway, while I was at the ER, that doctor said, "Hey, did you happen to know that your thyroid labs are really off? Like you need to see someone about this really soon." And I had no idea. I mean, nobody else was like yelling and screaming that this is serious. They're like, "Well, we'll check them in a couple months. No big deal." But anyway, it was a big deal, or is a big deal. Graves' disease untreated can kill you. And I have heart problems already, so my heart is already weak, and Graves' disease like impacts the heart greatly. So it's just not a good thing. But anyway, I have continued to lose weight, and I was trying to think what else. So I saw an endocrinologist here locally where I live, and she ran some blood tests, and it's called a TSI antibody was one of them that she did. It came back elevated, so I was formally diagnosed with Graves' disease on October 31st, 2019. Although we know that I had Graves' disease all the way back until like May of 2019. So anyway, I am frequently losing my voice, or I'm hoarse. Like people think I'm sick, like have a cold or something, and I don't. Constantly, like if I swallow things, if I swallow like a cracker or something, it gets lodged in my throat, which is not pleasant. Medications get lodged in my throat. That's not cool either, especially when they taste nasty. So anyway, part of my healthcare team includes 2 endocrinologists. And one of the most frustrating things with modern medicine is that you can put 50 doctors in a room, and all 50 of them will say something completely different. It drives me nuts. Like, it's just insane. So I have one endocrinologist that is saying that I should do Graves' disease never goes away. It's always in your body somehow. But to help lessen the symptoms and basically to save my life, I have a couple options. I could do nothing. That's a possibility. One that I haven't ruled out with all the other issues that I have. Taking out another organ in my body is a little scary for me. So anyway, back to what I was saying. I could do nothing. We could take my thyroid out with surgery. They could do radiation to not to the thyroid, but you swallow this pill. It's called radiation. I forget, RAI. They radiate your thyroid and it dies. Or I could remain on a drug called methimazole for the rest of my life, and that drug has some really, really nasty side effects, and it does not always work. So that's where I'm at right now. I haven't made a decision. A lot of my decision will probably ride on what my eye doctor tells me. Graves causes eye problems. So I'm having a comprehensive eye exam done soon by an ophthalmologist who is familiar with Graves' disease. And so if I do have Graves' eye disease, I cannot have the radiation because a lot of people, I guess, go blind. I'm not sure what the correlation is, but there's some type of correlation that makes it super dangerous. So I will be having that test in March, the eye exam. And then as far as I'm concerned about the radiation for my vision. I'm concerned because I've had radiation so much in the past already. And I'm concerned about radiation because I'm not sure that it will take away the goiter that the Hashimoto's has created over 10 years that's made it hard for me to swallow. So those are my kind of pros and cons to the radiation. It would be nice to not have a surgery. that's one plus. But anyway, the other thing is to have surgery. It is a major surgery to remove your thyroid. And with so many complicated health issues, of course, that puts me at a lot of risk. So anyway, it's just hard to make decisions. It's just hard when you have choices involved and you don't know what's best, and it's just hard. So anyway, I'm prayerfully trying to make a decision about what I would like to do about this. So in the next few months, I will be deciding about the thyroid issues. And then, of course, my adrenal cancer follow-up scans are in March. So we'll see how that goes. Anyway, I just wanted to tell you a little bit about Graves' disease. I am not a doctor, but it's just my experience with it so far. Thanks for watching. See you later.